Ladies and gentlemen, thank you very much for invitation and presentation. I am Edin Hajdarpasic. I am coming from Montenegro. Montenegro is a small country which is located in Balkan. Today I will share with you some information regarding drug abuse in Montenegro and some information regarding to our projects which we realized in the capital city in Montenegro. Drug abuse in Montenegro, a serious problem. Can you see from there? Okay. A serious problem. Abuse and illegal trafficking in drugs and psychotropic substances is perceived as a serious problem in Montenegro, European Union, and globally. The treatments and health, safety, social well-being, and prosperity of the general population, especially young people. Drug addiction is recognized as an important social healthcare problem which represents a risk to public health, especially relation in infectious diseases, HIV, hepatitis J, hepatitis B, tuberculosis, and sexually transmitted diseases. Abuse of drug and psychotropic substances may endanger and safety of all societies and rule of law, cause suffering both to individuals and families, and can lead to loss of life. Evolving of drug addiction. According to experts from this field, definition of drug addiction as a passion for enjoyment is long audited because drug addiction occurred by evolving much wider dimension and growing the scope of ordinary passions. And this become a disease by evolving in the negative way for the people and has become a characteristic of whole culture and new principle of lifestyle. It is almost impossible to reach all those who are in contact with the drug. Due to the fact that its mass production made incredibly cheap, drug and death drug addiction has become a global phenomenon. It is no longer a pastime for richest, but also the wealth of the poor. Drug addiction is drug addiction. The most common reason for drug use, especially with the young people, are curiosity, leisure, way to be in, to grow up, to belong, and be accepted, to avoid problems. This is somewhat in line with the age of these minors, rich with imagination, but no life experience. Most user holders or drug addicts think that their organization of lifestyle will be better, and the science to reduce or eliminate tension, anxiety, dissatisfaction, depression, which are integral part of life. Other changes are due to the impact of drugs on the nervous system, and they disturb social function, relation with family, peers, partners, and objectives. But they fail to solve all those problems in life, at last not in a way that would satisfy them. They seek alternatives, seek remedy. Wrong elected cure for the person become a drug intoxicant, which leads to constant drug use throughout habit. Warning statistics for small country Montenegro. Data of the research team, the Institute for the Public Health of Montenegro in 2011 processed 38 primary and secondary schools in Montenegro, approximately 4,000 students, shows that 6.5% of high school students come into contact with drugs, respectively, they use it, while those among primary school 0.4. We have no illusion that there will not be a drug addict in Montenegro, but our tendency is that drug addiction does not exist at a percentage of 10 to 15% of population. The program of drug abuse prevention activities. The program of drug abuse prevention activities was made in Montenegro. The target group that needs to work on prevention program, according to experts, primary should be from the 15 to 18 grade, but it does not mean that high school students should be neglected. The reasons what children stated a motive why they use drugs perfectly match to research at the global level. In 44% of cases, they did so out of curiosity, and 32% because of socialization and conversation. From the non-governmental organization called Rebirth, dealing with drug addiction is classified into on the biggest social problems, and it is the fact out of 626,000 inhabitants of Montenegro, as many as 60 are affected by this problem, drug users or members of their families. According to data of the research team Institute for Public Health, mostly used are marijuana and pills mixed with alcohol addicted in Montenegro. Personally, I'm specialist. I cannot agree with the division of drugs in the level light and heavy drugs, because all drugs same and lead men to diseases. Institutions in Montenegro. There is only one specialized institution for accommodation, rehabilitation, and resocialization of users of psychoactive substances of the treatment of drug addicts in the capital city, Podgorica, Kakaricka Mountain, and it is currently located about 130 addicts men, and at this moment, construction of pavilions for women is in the process. Outpatient treatment is at slightly higher level exists in Kotor and Podgorica, clinic center of Montenegro. Strategic, yes, the government on Montenegro adopted the new strategic response of drugs, 2011-2016, where it's planned to invest about 4 million. The prevention of cigarettes in the secondary school. Some words about our project which we realized in the Montenegro, in the capital city of Montenegro, Podgorica. We encountered mixed results while doing research the prevention of cigarettes in secondary schools in Podgorica. The sample was made in 4 schools where we have done sample of 2 departments, about 60 students. We made it also in Gymnasium Slobodan Škerović, High School of Economics, Mirko Vešović, and Medical School and Gymnasium 25th May in Podgorica. After we get the results from all schools, we held a workshop to press and the result to students and inform them about what is the representation of cigarettes and smoking in high school in their city. You can see from diagram some of results. What we present of them are as follows. 39 of boys use cigarettes, 21 of girls use cigarettes, 40 does not use. What is the reason to start? Most of them starting using cigarettes when 16 years old, 43. Period in which they started to use is period during the high school, 55. At the urging of the friend, become a consume cigarettes, 41. Reason, most often cited is a relaxation from the stress, 33. Although young people are largely aware of the harm consequence caused by smoking around 60, 33 of them did not even try to stop consumption of cigarettes. We have been given best result when schools are individuals concerned in Tuzi in Gymnasium 25 May, where we came across 15 of boys who smoked cigarettes and 9 of girls who smoked cigarettes. The largest percentage of consumption in the Gymnasium Slobodan Škerović, where we accounted 33 of boys and 28 of girls who smoked cigarettes. It is necessary that school programs include youth before the establishment of certain forms behavior in location in prevention of drug abuse in the broad framework and promotion and preserving of health of young people and relying on numerous of research studies. As risk behavior does not exist as an isolated individual, but usually exists between several programs for healthy lifestyle of young people. Should begin from kindergarten, continue through elementary school, continue through their school. Thank you very much.